So you've been diagnosed as having fibroids. And how is that diagnosis made? Sometimes it's based on a physical examination. Consider the following. The uterus, as we talked about, is that muscular container that can accommodate a growing pregnancy. Normally, if you run your fingers over the uterus during a pelvic exam, the uterus will feel smooth. Once she starts to develop fibroids that start to protrude on the outside surface, the uterus will go from feeling smooth like the back of your hand to irregular and lumpy, as though you were running your fingers over your knuckles. And so that is how the gynecologist is able to perceive that you have fibroids. The uterus feels larger than normal because of the fibroids, and because of the fibroids, the uterus is starting to feel irregular. So irregular and enlarged uterus equals fibroids until proven otherwise. So once your gynecologist suspects that you have fibroids, most likely the next step is an ultrasound. And the ultrasound is a very a very common test that's done quite often to evaluate a woman for her fibroids. The ultrasound will basically tell the physician how many fibroids, how large the fibroids are, and the location of the fibroids. And that's very important in determining what do we do next, how best to manage. You want to know approximately how many, how large, and where are they located. There are other diagnostic tests which are sometimes used in the evaluation or in the management of fibroids, like a CT scan of the pelvis or an MRI with and without contrast of the pelvis. These tests are more expensive, therefore they are not offered as readily as the ultrasound. But there will be some women who do benefit from having additional imaging, i.e. MRI or CAT scan. In addition to determining if a woman's anemic, and that's through a blood test called a CBC, complete blood count, you want to know, are there any other factors that might be contributing to the growth of her fibroids? And that would be the determination of vitamin D level. And if she is over the age of 35, she would benefit from assessment of the endometrium. Any abnormal bleeding, and excessive bleeding is considered abnormal, warrants further evaluation in a woman over 35 for all the other possibilities that might potentially cause abnormal bleeding, such as polyps, adenomyosis, cancer, and that's the one that we dread most often. Cancer is not the most common cause for abnormal bleeding, but it's the one you don't want to miss. And so there is a number of diagnoses that need to be considered and evaluated in a woman over the age of 35 with abnormal bleeding. But back to the fibroids. We want to know, is she having excessive bleeding because of the fibroids? And if she is having excessive bleeding, is she anemic? And then we want to treat the anemia. We want to treat the anemia, which means we want to slow down the bleeding, and at the same time, we want to build up her blood count. The other thing we want to review with the woman is her desire for children. Her desire for children may rule out possible options in terms of management and treatment of her fibroids. And then we just need to discuss with her the quality of her life and whether or not or how much the fibroids are impacting her quality of life. And from there, symptoms, knowing her baseline labs, getting a diagnostic evaluation, finding out her preferences about or her where she is in terms of childbearing, will help us to be able to come up with something that makes sense for her. It's not one size fits all when you're talking about the treatment of fibroids. It has to be tailored to the woman and where she is in her life. So when we start talking about, well, how do I manage my fibroids? There are a couple of things to consider. Sometimes what you will receive from the gynecologist is just treatment to manage the symptoms. The biggest symptom, or one of the more problematic symptoms, being heavy bleeding. And so you can manage the symptoms often with medication. And there are a slew of medications that we can consider. And if you want to know what they are, you can send me an email at mail@drrahman.com, and I can review the medications. Or maybe in this video, we'll start talking about the various medications that are used to control the bleeding secondary to fibroids. One I'm sure most of you are well aware of, and that's birth control pills. Birth control pills are often given to control the amount of bleeding a woman experiences during her cycle as a result of the fibroid tumors. There are other medications available just for the control of the bleeding. And then there are procedures. There are procedures that women will sometimes undergo to help eliminate or control the bleeding, such as an endometrial ablation. And we can go into further discussion about that at another point. And other than medications and other than procedures, there's surgery. And another procedure that I'm sure many of you are aware of is uterine fibroid embolization. And that's where you block the major blood flow to the uterus, which is through the uterine vessels. And by blocking the flow, you essentially starve the fibroids, and they tend to shrink. So there are a number of procedures, and then there is the surgery. And when we're talking about surgery with fibroids, we're usually talking about a myomectomy versus a hysterectomy. And the difference is a myomectomy is a surgical procedure to remove the fibroids, leaving the uterus in place. A hysterectomy is removing the uterus along with the fibroids. Not having a uterus means two absolutes for you. One absolute is you will never have another menstrual cycle because you don't have a uterus. And also, you will never be able to carry a pregnancy because you don't have the uterus in place. So again, you may remember my demonstration from a while back. If my upper torso is the uterus, which is that muscular container, and this are your fallopian tubes, and this is the ovary, a hysterectomy involves removal of the uterus. Removal of the uterus. Removal of the tubes and the ovaries is a separate procedure. If you were to remove both tubes and both ovaries, that's called a bilateral salpingo-oophorectomy, BSO. Now, in terms of what do you experience after the procedure, if you have a hysterectomy, which is just the removal of the uterus, you shouldn't go through an early or premature menopause. But if you have removal of the ovaries, and we've already spoken about the fact that it's the ovaries that produce the hormones. If the ovaries are removed, and you have two, one on the left, one on the right. If the ovaries are removed, then the production of hormones drops dramatically as a result of the surgical procedure, and that woman will experience menopausal symptoms as a result of the decline in her estrogen level. To continue, I get excited talking about fibroid tumors because it's time that, first of all, there just needs to be more research so that we can give women better options. Um, Hysterectomy is the #1 procedure done in this country for fibroids. And why? If it's possible, and if fibroids are benign, it should be possible to offer women something that's a more benign procedure other than a major surgery. So what I get excited about is the fact that more recent research has showed that the environment that we live in can potentially affect the development of our fibroids. And this is game changing in my mind, meaning that it's sometimes referred to as epigenetics, meaning the food we eat, the habits we engage in